name is Majida. I'm here with Grafan and Dr. Okoro from Amachi Med Spa and Georgia Plastic and Reconstructive Surgery. We are going to be talking to you guys about vaginal rejuvenation today. We'll be discussing non-surgical vaginal rejuvenation as well as surgical vaginal rejuvenation. So we're going to get started. Okay, so like I said, we're going to talk about the different types of vaginal rejuvenation. Down in Amachi Med Spa, we do non-surgical vaginal rejuvenation, which is ThermiVA. So that's what I'm going to discuss. And then as we get to the more invasive, I'll pass it on to Grafan and Dr. Okoro. Okay, am I going too fast? I am? Okay. So the first thing we're going to discuss is ThermiVA. ThermiVA is the non-surgical vaginal rejuvenation. And just to show you all, this is what the ThermiVA wand looks like. Of course, the actual wand that we use is sterile. We do use a new wand each time that the patient comes for a treatment, but this is just a demo wand so you can see. I don't know if you guys can see this, but the wand only goes 10 centimeters deep, which is very comfortable. And this tip right here, that is where the radio frequency is being emitted from. So it allows us to treat the entire vaginal canal and the bladder. After we treat the vaginal canal, we do come out and we treat the labia majora and minora. So it gives you a full overall vaginal rejuvenation treatment. So, as I said, it is non-surgical. There is no downtime from ThermiVA. So you can come in, have a ThermiVA treatment, and carry on with your regular everyday life. I actually just finished one. I have another one later on. It's very comfortable for the patients. Our treatment rooms are very, very comfortable. So you can carry on with everything right after the treatment. You can see the same day results because the skin and the tissue on the vaginal is very delicate. So it really takes to the heat from the radio frequency. So we can actually see the skin starting to tighten. We can feel the vaginal canal starting to shrink as we're doing the treatment. The treatments you can do them 2 to 4 weeks apart, depending on what we're treating. A lot of our patients do like doing it 2 weeks apart as opposed to 4 weeks apart. It just gives them quicker results. You'll still get the same results if you wanted to push it out for 4 weeks, but we kind of recommend doing it 2 weeks apart. In order to start their vaginal rejuvenation with ThermiVA and with Georgia Plastic, you do have to have a recent pap smear, which is reviewed by one of our PAs and one of our doctors, Dr. Parker, Dr. Okoro. They'll go ahead and clear you for the treatment, and then we can start the treatment the same day. So doing ThermiVA, it does assist, like I said, with the tightening of the vaginal canal. It also helps build that, strengthen that bladder, that muscle that keeps the bladder up. So it helps with incontinence, which is one of the main reasons why a lot of our patients come and get ThermiVA. It helps with the pH balance of the vaginal canal, so it helps with the lubrication, and it just makes your sexual experience more enjoyable for the female. So it helps with, achieving orgasm. So a lot of our female patients come in, they love the ThermiVA. It's probably one of our highly recommended treatments. However, we probably can't market it as much because of the pictures. It's very sensitive, but it's a very, very high word of mouth recommended treatment for Amachi Med Spa. Okay.
I'm Griffon. I'm one of the PAs here at Georgia Plastic. We're going to next move on to the next invasive vaginal rejuvenation procedure, which is Aviva and Morpheus. This can be done in our minor procedure room upstairs in our clinic. So it's done in the office. As far as numbing goes, this can be slightly more painful, but we use a topical numbing cream on top to make the patients more comfortable. Almost similar to the ThermiVA, there's not a lot of downtime. This has about 1 day of soreness, and and no sexual intercourse for 2 days. And after that, patients are usually good to go. For this, you'll do 1 treatment and then you're good and re-up every 3 to 5 years. So you don't have to keep coming back. This treatment is a probe, similar to ThermiVA. It uses radio frequency heat technology, except this is a very small probe. You can see at the bottom of the screen that you make a small micro incision, and that probe goes into the skin and heats with radio frequency heat from the inside. It keeps the surface of the skin at a normal body temperature so it didn't get too hot, and heats from the inside. And you can actually do this on the labia majora and the labia minora. And this helps with tightening if you have loose excess skin in the vaginal area. This will help with both of those things. We usually do this in combo with Morpheus, which also uses radio frequency heat. But it's needles that will get injected into the skin very quickly. The tips of those needles will heat up with radio frequency heat and also help with that skin tightening as well. But like I said, you don't need any medications for this. You don't need to be put under for this. It can be done easily in our office upstairs at any time. The next thing is for Dr. Okoro.
Awesome. Thank you. You guys have done a wonderful job. I hear radio frequency, radio. IMF must be in. Awesome. Okay, so we are going from non-invasive to invasive vaginal rejuvenation. Now, some patients may be able to benefit from non-surgical labiaplasty with Aviva, which was what Griffon was talking about as well. So, but for those patients who are not a candidate for non-surgical labiaplasty that have a lot of discomfort, a lot of excess skin, the next stage will be labiaplasty, which is when we remove the excess skin. Again, this procedure is also done under local anesthesia in our operating theater. Everything is numbed up. There's no need to go to sleep. Patients are very comfortable. Downtime is about 1 day or so. Many patients are able to go back to work in a few days. There's no sexual activity for 6 weeks. It can also be used to treat labia majora and minora, depending on the problem. And sometimes we can even combine it with fat transfer to the majora if needed. The cost is about $3,500, and that's a one-time cost. Next. The next thing will be vaginoplasty. This is the actual tightening of the vaginal canal, and this is a surgical procedure that usually requires general anesthesia, even though it can be done under local, but general anesthesia is preferred and much better for the comfort of the patient. Again, it's just like labiaplasty. There's no sexual activity for 6 weeks. This is the ultimate vaginal tightening. If you don't want to undergo vaginoplasty, you can do ThermiVA, which is very effective as well. Vaginoplasty can be combined with other surgical procedures, including Labiaplasty or Aviva and other things like that. And we also combine vaginoplasty with what is called perineoplasty. Basically, when we tighten up the entire pelvic wall, I typically would do that with vaginoplasty. So it's vaginoplasty with perineoplasty. That's it.
I do want to say that we do have some before and after photos on our Real Self pages. So if you want to visit Amachi Med Spa or Georgia Plastics Real Self, you'll be able to see our own patients, our before and after photos. So just head by there, check those out. We are having specials this month in Amachi Med Spa. This is our 3-year anniversary. So this entire month long, we are going to have a special for our ThermiVA treatments. So just give us a call. We can get you on the schedule. Our phone number is 770-485-6466.
All right, bye. Thanks for joining us.
Thank you. Have a wonderful day. Bye-bye.
Bye.